My name is Sydney Walden, and the disease I will be discussing is peritonitis. The patient I had that presented with this illness was a 35-year-old female who was a transfer from an outside hospital. This patient has a past medical history of hypertension, end-stage renal disease requiring peritoneal dialysis every day for the past 10 years, anemia, thyroidectomy, and seizures. This patient originally presented to the outside hospital due to nausea and vomiting and increased weakness that extended over 5 days. She had a loss of appetite, fever, and a rigid, painful abdomen. She was diagnosed with peritonitis and was being treated on the medical surgical floor of the outside hospital. She began having issues maintaining her blood pressure, and they had to start her on levo, and she was sent to UK. With transport by EMS, something happened with their pumps, and they were unable to give her the levo for the entire trip. So when she arrived to the MICU, her mean arterial pressures were in the 40s. So immediately we had to place an A-line. The patient was also having issues with bleeding from the central line that she came with that was in her femoral. We had to do several pressure dressings. We took like liter bags and placed them on her femoral to try and add more pressure. The physicians had to go in and do what's called a purse stitch to try and help it stop the bleeding. Her labs showed that she had a PT of 24.2, an INR of 2.4, and a hemoglobin of 6.8. While she was in the MICU, we did a peritoneal fluid analysis lab by performing a paracentesis at bedside. We also did lab work to monitor her white blood cell count and her electrolytes. Peritonitis is the inflammation of the peritoneum, which is a silk-like membrane that lines your inner abdominal wall and covers the organs within your abdomen. It's usually due to a bacterial or fungal infection. Peritonitis can result from any rupture in your abdomen or as a complication of other medical conditions. Signs and symptoms of peritonitis include abdominal pain or tenderness, bloating or a feeling of fullness, fever, nausea and vomiting, loss of appetite, diarrhea, low urine output, thirst, inability to pass stool or gas, fatigue. And if you're receiving peritoneal dialysis, which my patient was, peritonitis symptoms may also include cloudy dialysis fluid and white flecks, strands, or clumps in your dialysis fluid. Peritonitis requires prompt medical attention to fight the infection and, if necessary, to treat any underlying medical conditions. Treatment of peritonitis usually involves antibiotics. In some cases, it involves surgery. If it is left untreated, it can lead to severe, potentially life-threatening infections going throughout the entire body. And if you're receiving peritoneal dialysis therapy, like my patient, for instance, you can help them to prevent peritonitis from occurring by teaching them to perform good hygiene before, during, and after dialysis. Thank you.